Dr. Jay Burns with another segment of Laser Guru. Today's kind of special because just to show you how honest, transparent, and real we are, this just happened in the spur of the moment. I was talking to a patient of ours, Bethlehem, out in the waiting room, and she started talking, and I just got so excited. I said, hey, let's go shoot a segment because I think the world wants to hear this story because we hear it all the time, but she is eloquent and she tells it very well. So, hey, thanks for helping us out today. And again, this is Bethlehem, and I'm just going to let her tell the story of how she found us. I think that I'll fill in a little bit because Dr. Ben Tittle, who's a really good friend of mine, it's where I did my surgery and do my surgery. She used to work as a manager in that office and would sneak over here and get some treatments with skincare. And I'll just let her take it from there and tell her the journey that she's been on. And we'll just have an active interchange here. I think you'll find it very interesting, especially we're trying to focus this segment on skin of color, which is a challenge, and but how we've helped with that, and I'm really proud of that. So go ahead and tell us your story.
Yeah, thank you so much. So I have been a patient here since May of 2021, about 6 months after I had my first child, where I struggled. I thought I was a skin expert, but I struggled with acne, pigmentation, like everything you could think of. And Nancy put me on a treatment plan, and then she introduced me to MOXI, which I was hesitant on just because I've never had a laser and treating skin of color is difficult. I know that the risks are very high, but of course she talked me through every step. We did my first MOXI in June of 2021 or July, probably 2 months after being a patient here. And since then, I think I've had maybe 5 or 6 over the course of the last few years with other treatments in between. But MOXI was really what set me up right for my postpartum recovery, if you will, and really ignited that healing of my skin. And I've been obsessed with MOXI since.
Well, I'm going to ask you another question, but let me put my doctor hat on for a second and explain to a lot of people out there what the challenge is with people of color. And that is that the laser, darker skin has a protective nature to when sun hits it. The way it protects itself is it turns darker. So anything can cause that. It causes inflammation. That's not just a laser light, it's heat, anything like that. So we've really been challenged because if we wanted to treat, pregnancy mask occurs in everyone. That's a with a huge estrogen bolus, that can happen during periods. Growing up in puberty, you're shaking your head, yes, and getting a nod there. It can happen with pregnancy a lot because you dump this estrogen, and that estrogen causes, enhances any kind of inflammation in your skin. So you've seen it in people of all skin types, 6 skin types. So that's what was happening to you, and it can break out. You can have acne because of the estrogen and all those kind of things. The same thing you would get with a period, you can get in spades with during pregnancy. So my point is that's what you were experiencing. The other thing that happens is the reason it's hard to treat darker skin types is because when we do any kind of laser treatment that would treat acne, scarring, or anything like that, it can cause more inflammation. So the treatment is sometimes worse than the cure. So the thing that MOXI does is it creates just a right amount of superficial peeling of that pigment, because all the pigment's at the top, but not so much inflammation that it causes you to get that pigmentary dump. And so MOXI has been a huge boost for us. We've got a whole vertical of patients from even, notorious for that is Asian, Pacific Rim, any dark skin type, Hispanic, Black, excuse me, but here I get fooled sometimes with people with even look like they have lighter skin, and they'll get a dump, and I ask them, and they've got an 1/8 or 1/4 Cherokee Indian in them. And so anytime you have ethnicity, if you tell us, I'm so excited because when I heard you in the hallway just now, you were just so excited about your last treatment. Look how great it looks, right? And so you were also talking a little bit about a product that we did a study on that a company here named Revision has. It's called CMT, chemical, mechanical, thermal, if I'm not mistaking that. Any kind of thing that causes an injury to the skin. So I had it done, and I tested out this product a couple of years ago, and I had a MOXI and even a Halo, and I put that on my skin, and it was the only thing that calmed me down. And it's a neuroreceptive pathway that's never been really done. They patented before. It's not a topical anesthetic or anything like that. It's a way, a very ingenious way, that they block the signal from the skin to the brain, and they also increase the beta endorphins that give us a natural feel good. And the result is, I'll just let you tell us about the result that you felt.
I was gonna say, I had my MOXI done on Friday, so it's literally only day 4, and that's the only thing I've been incorporating into my skincare since then, morning and night after I cleanse, just applying about 2 pumps full face, and you can't even tell I've had anything done. Like, I had to get up close into your face so you can see the little bit of the mends that's left over, but I went straight from here on Friday to work and continued about my work day. Didn't have to rearrange plans over the weekend, and that's what I love about MOXI, in conjunction with this new product, to really help speed up that recovery and aid in better healing. But I kind of want to touch on what you said about different ethnicities. So because my transformation and my experience with lasers, obviously that's what I'm comfortable recommending to my friends and my family, who of course look like me, but coincidentally enough, my mother is here today getting a treatment done. My best friend's mom, who I've known since elementary school, is here getting her first ever MOXI BBL. And she's never had a treatment done.
And you didn't really know that you just showed up.
I just showed up, and it happened to be the same day. But I recommend to places that I know can cover everybody. My best friend's mom is Vietnamese and Mexican. My mom is Ethiopian. So from all skin types, skin complexions, I know that the training and the experience and the expertise here will not only treat me, but my mom.
Right, and we combined the MOXI with a technique that was popularized by one of the key opinion leaders that I lecture with all over the world, Jill Wobble. I want to give her credit, but we have aided that, what we call post-inflammatory hyperpigmentation protocols. So when we get treatments, we try to we go through that regimen, and so when we combine that with technology like MOXI, we are just so excited to be able to offer that to a whole new vertical of patients that have never been able to treat it, specifically people of color, ethnicity, people that are more prone to get that. And even if you have lighter skin, like I said, and you're not sure, if you tan very easily, and it's hard to sunburn, no matter what, and that can happen with in any color, I've found out, right? That gives you a tendency to have more of a tendency to pigment after a treatment. So I just wanted to get that word out. You got that word out to your family, and we appreciate that very much. But we wanted to get that out to the world so that people would know that there is, because a lot of people, because of the years of lasers kind of being biased, if you will, toward people of color, that's not really true anymore. And I want that word to get out, because we have so many patients that come in, and even if they can just get that constant melasma or pigmentary issue to fade just a little bit. Sometimes it's not perfect, but it's enough to wear normal makeup without having the pancake makeup and all that kind of thing. That it's these people, I just see it firsthand every day how grateful they are. You're representative of a ton of patients that come up and go, oh my goodness, there's a treatment for me now, and I just wanted the world to know that.
Yeah, I agree, and I love everything about MOXI, and that there's a solution for everybody, and you really can target whatever that goal might be, whether it's from one treatment, a series. Like I said, I've done it over the last couple of years, and the best way to explain my skin is I feel like I'm walking around with a filter. Literally, like from the luminosity to my pores to my texture to the pigment, like everything. And it doesn't have to be painful. It doesn't have to require downtime. I think a lot of people associate lasers to aggressive or something like Halo. And I've even scheduled Halos and backed out, right? Because I know that I can get what I need out of continuous MOXIs. If I want to do them quarterly, twice a year, it's just...
And everybody's different, and that's what we try to do here, is we try to match your needs and goals with whatever we want to. It might be for some people, they might want to go with a Halo and the post-inflammatory protocol, but they're taking a little bit more of a risk in their skin. So it's always great to come in and do something with like a MOXI. And these lasers that we're mentioning is, people think I'm I have different lasers. I don't have just one company here, but I will tell you that Sciton, we have their complete armamentarium because I just think they make amazing lasers. And the ones we happen to be talking about, I don't use them because I've got some kind of deal with Sciton.
Right.
I have some kind of a teaching deal with Sciton because that's what I teach my residents because I think they're fantastic lasers, and they give me the technology that creates, a whole new vertical of patients that I could never touch before.
Yeah.
I can treat young patients now with BBLs that and maintain their skin so they never have to get that more aggressive treatment with me. So, excuse me, I'm still getting over this little cough. But the fact is that I just wanted to, despite the fact that I was having that little cough, I still wanted to talk to you today because I didn't want to get you out of the office because you got me so excited. I wanted the world to know. So thank you so much for joining us today. And I hope you enjoyed this session on Laser Guru. And we're enjoying doing it, and it's really taking off, and we're getting a ton of followers. So it's shocking that they would follow an old man like me, but I'll tell you, I'm having fun doing it, and I'm really having fun treating patients like Bethlehem. And I hope if you want to, if you live around this area, if you don't live around the area, keep following us, and hopefully we help you ask the right questions, and hopefully we educate you so that you'll find somebody that can help you with some of the technologies we're mentioning. And if you live in the Dallas-Fort Worth area, you come by and see us. We're Resurrect Skin MD. We're in Preston Center and 8226 Douglas. And you can call our office at 219-754-6865. Again, you can call our office at 219-754-6865. So we thank you for your time, and thanks for joining us, and spread the word to all the people of color and to people with skin everywhere. Take care.